Hi, I'm Dr. Bryan Wang and I'm an orthopedic specialist in private practice. I completed my specialist training in 2015 and have a further subspecialization in the field of sports injuries involving the shoulder, elbow and knee. I've been running my own practice at Gleneagles Hospital for the past 3 years at Beacon Orthopaedics. Okay, the rotator cuff is a group of 4 muscles, one at the front, one at the top and 2 at the back, that help you to move and elevate the shoulder. The rotator cuff also plays an important role in the stability of the shoulder joint. When there are injuries to the rotator cuff, that might result in weakness, pain, or difficulty in doing overhead activities. Rotator cuff injuries typically occur as a result of impingement from a pre-existing bone spur. This can result in tendinitis or inflammation of the rotator cuff tendons. Following a period of time, sometimes the blood supply to the rotator cuff decreases, and this can lead on to either a partial or complete tear of the rotator cuff. Sometimes with prolonged inflammation of the shoulder capsule can also undergo some thickening, and this can result in what we call frozen shoulder or adhesive capsulitis of the shoulder. Sometimes with long-standing or chronic tears of the rotator cuff, this can result in a massive rotator cuff tear, and with time this can result in arthritis of the shoulder as well. The initial management of rotator cuff injuries typically involve a trial of non-operative treatment. This may include rest and avoiding overhead activities, medications to reduce the inflammation to the shoulder joint, as well as some physiotherapy. If the pain is persistent, sometimes injections such as cortisone injections may be helpful to reduce the pain and inflammation. Sometimes, if the pain and weakness is persistent or you have a large rotator cuff tear, surgery may be required to deal with the underlying issues. If your pain is persistent despite a trial of conservative treatment, you have difficulty sleeping and have difficulty doing overhead activities as well as your activities of daily living, or you note that you are developing some increasing weakness of the shoulder, you may benefit from a review by your orthopedic doctor. Okay, there are different strategies you can do to avoid or minimize the risk of rotator cuff injuries. This may include, number 1, ensuring that you do proper warm-up before taking part in any physical activities. Number 2, you can strengthen the muscles surrounding the shoulder area, such as the chest muscles, the upper back muscles, as well as the muscles around the shoulder blade or the scapula. Okay, thirdly, you should avoid repetitive or prolonged overhead activities, as this can cause repetitive impingement on the rotator cuff. And last but not least, I think this is something that is very often underestimated. It is to really spend time listening to your body. So if you feel that there is a persistent pain in the shoulder, do not neglect it and be sure to see a doctor if the pain is not better despite a period of rest.